Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the full mouth CBCT of the patient that you had requested. The area of interest has not been highlighted, so we will take you through the entire CBCT. The upper right second premolar and molars are missing. The lower right premolars can show a fracture here, and we can see a radiolucency and bone loss around it. There are implants placed in the lower left region with a premolar that seems to be grossly carious. The upper left does not show anything significant other than bone loss and periodontal disease that can be associated with these teeth. Now, moving to the panoramic view. On the panoramic view, we can see the upper right region is edentulous. We've got a radiolucency associated with the lower right first premolar. We've got implant placement, which seems to be appropriate. Moving to the transaxial view on the upper right second premolar region. This is the upper right second premolar region. I'm going to zoom in for our doctor. The ridge appears to be B3 in its the quality of the bone. The ridge is quite knife edge at the crest. We have a buccal defect present here. But if we are in the premolar region, we can clearly see that we have approximately 4.6 millimeters in just below the crest of the ridge, and the height to the sinus floor is approximately 8.6 millimeters. Moving to the molar region. In the molar region, we will be able to see that the ridge quite significantly reduces in its height. But if we have to measure the height of the ridge is approximately 4 millimeters to the floor of the sinus. And if we have to measure the ridge width is approximately 5.3 just below the crest of the ridge. Moving to the second molar region, this is the second molar region. The ridge is slightly thicker towards the palatal aspect. If we have to measure, it's 5.5 millimeters, whereas the height is 4.8 millimeters. But if we look at the ridge, it is much more thicker and can actually go up to 5 millimeters. But on the buccal side, the ridge does seem to be quite atrophied. Moving to the lower right premolar region, which I will highlight for our doctor. So this is the lower right premolar region. We can see this is the crack present in the tooth. We're going to, it's split quite significantly, and we can also see that there is a radiolucency associated with this tooth. There we go. So this is the crack of the tooth, and this is the radiolucency associated with it. The buccal cortical plate appears to be quite significantly resorbed. But if we look at the association of the mental foramen is quite closer to the second premolar. And if we are moving mesially, we can see that the exit of the mental foramen is quite far away from the fractured first premolar. There we go. This is the fractured first premolar. The bone around it, the cortical plate on the lingual side is quite thick, and we've got sufficient engagement area underneath the radiolucency. Moving to the implants, the implants are placed quite center of the ridge. We don't see any significant bone loss apically or lingually, just close to the buccal aspect. If we move on to the molar region, the implant again placed very well in the center of the ridge, and we don't see any significant bone loss around it. Yes, some crestal bone loss can be seen, but not any significant bone loss. So this is the axial view. On the axial view, we'll take you down to the lower ridge. We can clearly see that this is where the split of the tooth is. The fracture is quite evident in this section, and we can see that the fracture goes, it's a vertical tooth fracture which goes all the way to the root level as well, and the radiolucency is associated with the mesial aspect of this tooth. The implants placed on the lower left region appear to be normal and does not show any significant pathologies associated with it. If we move to the axial view of the upper side, so this is the upper right region. As you can see, this is the right side of the patient. We do not see any significant sinusitis associated with this tooth. We do see slight sinusitis in the upper right sinus, but nothing significant. Looking at the coronal view, this is the coronal view, and if we take you from the front to the back, this is the area where the premolar is missing. The ridge seems healthy in the premolar region, but as we move to the molar region, this ridge significantly reduces. We do see anatomical variations between the left sinus and the right sinus, but no major sinusitis can be seen in this case either. If there are any further questions regarding this case, please feel free to reach to our team. Thank you very much.